Good morning, everybody. Welcome to our annual public meeting. Unfortunately, because of COVID, we can't be doing this in a public space with members of the public with us. My name's Graham Sayers. I'm Clinical Chair of Northumberland CCG, and in a minute I'll go around the rest of the people on the call and ask them to introduce themselves. We are a statutory body, and it is a requirement that we hold a meeting in public every year. And this is the opportunity for the public to understand the working of the CCG, to question us on any of the things that we do. There has been the opportunity to ask questions before the meeting, and this meeting is being recorded. It will be posted later for people to watch, and we can take more questions from the public after that if needs be, which could be answered at a later date. We have some apologies this morning. Andrea, would you like to tell us who we've got apologies from?
Thank you, Chair. We have apologies from Marius Adamu, John Warrington and Ben Frankel. Thank you.
Okay. So what I'll do on my screen, I'll ask you to introduce yourselves, and I will tell you who's coming next as well, just so that you can be ready. Okay. Mark Adams first, please, and Paula's after that.
Morning, my name's Mark Adams and I am the Chief Officer of the CCG.
Paula and then Steve.
Good morning, I'm Dr. Paula Batsford and I'm the Clinical Director for Blythe Valley.
Steve.
Good morning. Good morning, I'm Steve Brazier. I'm the Audit Chair for the CCG.
Andrea then Siobhan.
Good morning, I'm Andrea Brown and I'm the Clerk to the Governing Body.
Siobhan and then John Connolly.
Good morning, Siobhan Brown, Chief Operating Officer here at the CCG.
Good morning, I'm John Connolly and I am Chief Finance Officer at the CCG.
Thanks, John. Claire and then Liz Morgan.
Good morning, Colleen, I'm Deputy Director of Quality and Patient Safety.
Thanks, Claire. Liz and then Janet.
Good morning, I'm Liz Morgan. I'm the Director of Public Health in Northumberland County Council.
Okay. Janet and then Robin.
Morning, I'm Janet Guy, the Deputy Lay Chair of the CCG and the Chair of the Primary Care Commissioning Committee.
Okay. Janet and then Karen. Sorry, Robin and then Karen.
Yeah, good morning. Robin Hudson, Medical Director for Northumberland CCG.
Karen and then Rachel. Hi, Karen, are you there?
Good morning, I'm Karen Bauer. I'm the Chair of the Corporate Finance Committee. I'm a lay member on the governing body and I also have a responsibility for public and patient involvement.
Thanks, Karen. Rachel and then Tony.
Good morning, I'm Rachel Long, I'm Corporate Affairs Manager for the CCG.
Tony then Annie.
Good morning, my name's Tony Brown. I'm North Locality Director for the CCG.
And then Annie and then Paul.
Good morning, I'm Annie Topping. I'm the Executive Director of Nursing, Quality and Patient Safety at the CCG, and I'm the board nurse on the governing body.
Thank you, Paul and then Chris.
Good morning, Paul Turner, Director of Commissioning.
Hi, I'm Chris Waite. I'm Joint North Locality Director with Tony for the CCG, Meds Optimisation Lead and a GP.
Thank you, everybody. If everybody could make sure that your mics are muted now for this next bit, and then we don't get any interruptions unexpectedly. So this morning's meeting is going to take us through a number of slides. We're going to have presentations from various people, which is going to illustrate the work of the CCG and the work of the committees that ensure that the CCG performs its role satisfactorily. It's obviously been an interesting year, a challenging year to do with COVID. But obviously, despite that, it's been extremely important to keep the workings of the CCG as they usually would be, to concentrate on all of the other aspects of care for the population of Northumberland. So this morning is going to show you a number of the aspects of how that's been achieved. So I'll hand over to Siobhan Brown, our Chief Operating Officer, and she's going to take us through the annual report.
Thank you, Chair. Andrea, it would be really great to see the slides. Thank you. As Andrea's putting those slides up, we're now in our 9th year as a CCG, our 9th year of existence. And today is very much about our reflections on the year 2020 and 2021. And suffice to say, it's a year that has changed not only the NHS, not only the country, but the world. And that is the context in which I will discuss our reflections on last year. So thank you for watching, thank you for listening. And if you have any questions about what we're going to say, please put them in and we'll get those answered for you. I think as a board, it's always really good to reflect on our purpose and our role. And clinical commissioning groups were set up very fundamentally about being close to our local patients and population. And that's why the 38 GP practices here in Northumberland are all members of our CCG. And the rationale for that is that we're really close to the understanding of what our patients need and what our population wants. And we're responsible for commissioning, which is the buying and planning of all of the services within Northumberland for you. Next slide, please. I also like to think of our CCG very much as the glue in the system and system enablers that keep everything together. And over our time in the last 9 years, we've taken time out to refresh and think about what it is we want to achieve here in the CCG. And that is very much around making sure that the money, the Northumberland pound that we spend here in county is used in the best way possible, that the quality of services that we deliver are really high. And fundamentally, we have really excellent services in Northumberland, which is brilliant. We're also very keen to start joining up pathways of care across boundaries and across services that are literally wrapped around patients and not the other way on. And a very important part of this, and one I'll come back to a little bit later, is we've got to deal with inequalities in our system and outcomes. And we need to listen to people in neighbourhoods about what they think they need to make life and their well-being as important to deliver and live for them. Thank you. Thanks, Andrea. Next slide. I do want to start with the pandemic. It's absolutely dominated all of our lives, both personally and professionally. And the thing that I would really like to say about this, all of this has only been achieved through partnership working, extraordinary partnership working, and that's beyond the NHS. That's very much with the local authority, voluntary services and volunteers in our communities. And what's important about this is not only have we had to look at how COVID has impacted on illness, access and admissions into hospitals, we've also been really central and pivotal in the delivery of vaccination programme. And it's wonderful to report to you that very often we are the highest in the country in terms of our vaccination rates, which is very much about planning and listening to what our people need in terms of rurality. So we have a roving model that's involved in that too. There's also an excellent health protection board that we're part of, led by our Director of Public Health, who's on our board here today as well. And that's been phenomenal at delivering everything that's needed to our county during this last year. So everything that we're reflecting this year is in the light of this context. Thank you. Thanks, Andrea. In terms of some of the key things, what have you done this year? What have you achieved? Aside from all of that work on the pandemic, there are some real clusters of work that we've been involved in. For us, mental health and well-being is utterly important. And what we want to do more and more of is catch people upstream before they get ill. So yes, we've got really good services when people do become ill, and our access times have got extraordinarily better over the years. It's also about keeping people well. So we're working a lot in schools now about children's resilience, where we have opened quite a lot of support up to teachers and to other groups. We're looking at digital solutions. But one thing we must never forget, in a year that lots of digital access has been really escalated, is that we have to be inclusive to others who might not use digital services. So we're very, very mindful of that. Other things that we've had a really good look at this year, in this last year, has been our special educational needs and disability services. And I'm happy to report we've had our formal letter saying that we've done really well on all of our areas on work on that. And again, that is testament to partnership working. There is not a thing we can do in the CCG alone, and that comes across very, very strongly. In terms of our urgent and emergency care services, we've been one of the first in the country to try and promote 111 as first point of contact. And we're learning a lot from that, and now we're rolling that out, and other areas are picking that up as well. It's not without challenge, and I will come to that, because the amount of volume and pressure in the system is immense. But we're doing really well in terms of trying to make sure that that works for people as we go forward. And in terms of elective care, so that's surgery, outpatients, areas like that, we've really tried to simplify pathways and get people to their care as fast as possible. And a really good example of that is around our dermatology pathways, where doctors now can take pictures of potential lesions of the skin, send them through to consultants and get really fast results on that. You'll be aware that there's such a thing as long COVID now. We're discovering more and more about that. And as a CCG, we're working really hard to make sure that services that keep people well at home and also help people manage long COVID, which is mental, emotional and physical, get the support that they need. And from a primary care perspective, our primary care services have contacts of over 1.5 million a year, which is a phenomenal amount. And through COVID, they have changed and operated other access models as well as face-to-face care through that. And that is starting to revolutionise the way we look at care. But there is something to say about personal contact and face-to-face care that will always, always matter. Thank you, Andrea. In terms of engaging our communities, we're really growing this area in terms of patient and public involvement. And there's been some very specific pieces of work that we've done really well and have helped identify how we deliver services. So, for example, around our special educational needs and disabilities, we did a big survey towards at the end of the second wave of COVID to find out what would matter to them, how we got good access to people, making sure that we weren't increasing inequalities. And there are other examples in there as well that you'll see. And we try a really big range, right from online communities down to neighbourhood level. And what we're going to be trying to do more and more as we move forward over this year is proper co-design with communities about what they need in their areas that will keep them well and healthy. Thank you, Andrea. In terms of performance, there's no shadow of a doubt that COVID has impacted on performance of our services, and that's not unique to us here in Northumberland. It is nationwide. What I will say, though, is the strength of our services and the high performance of our services have meant overall that we have managed to recover more quickly in some of these areas. Unfortunately, though, we do have some 52-week waits, and we're working really hard with our acute colleagues and also involving others in that to get that backlog down, and also things like diagnostics. We want to make sure that every condition, every health issue that people have is dealt with and doesn't suffer from what has been an incredible time around managing COVID. In terms of cancer, our performance generally remains strong, but there's no doubt about it that there's still recovery needed in that, and making sure that we identify as early as possible. In terms of urgent and emergency care, as I sit here today with all of you, we are seeing unprecedented volumes in every part of our service, right from primary care, mental health, A&E and our ambulance services. And we have a wide range of ways of trying to manage that flow across all of those. And we've done particular work with our colleagues in hospitals and also with our ambulance services about getting people to the right place. And ideally, the whole issue around self-care and use of pharmacy, we're trying to grow that even more so that people feel in control and confident about the best way to manage their own health, but that when they need services, they're there. I mentioned mental health earlier. There's no shadow of a doubt about it that mental health through COVID and post-COVID is going to be phenomenally important about keeping people well. And we work really hard at keeping our access times really short and broadening out the services for people as they need them. Thank you, Andrea. And in terms of looking forward, I said it was the 9th year of the CCG, and it is actually our last year as we start to move into what's called an integrated care system. What matters to us as a board and what it matters to you watching will be what we do here in Northumberland for the patients and the population. And I can assure you that place-based working and all of those relationships that we have built and all of that work that we have done over these previous years will be the foundations of where we go from here. We will be working more and more around making sure that wherever you are in the county, you have really good access that's equal to others, that your experience of care when you need it is high, and that we start to turn around some of the poorer health outcomes of our people, but we do that with you. And we design in neighbourhoods what matters to you and deliver that with you alongside you. And finally, Andrea, just want to say a really huge thank you, and that's not only to the NHS staff, care staff, but the whole of the public here in Northumberland, and no shadow of a doubt that it's affected all of our lives, both personally and professionally. I'm aware we're not out of the woods yet, but I can assure you from our board's perspective, we will just do everything in our power, not only to manage COVID and its impact, but also keep all of other services that we've got on track. Thank you so much. I'm going to hand you over to John Connolly, who's our Chief Finance Officer.
Thank you. I'm just going to take us through a few headlines on financial performance, where the money was spent and the financial outlook. We had for 2021 a total allocation of just over 600 million. And we met the financial target to remain within this allocation, delivering a surplus of £900,000. We also met all our other financial targets, including the requirement to increase spending on mental health and to remain within our running costs allocation. And from our external auditors, we had a completely clean bill of health. Due to the pandemic, interim financial arrangements were in place throughout the whole of the year, very much with an emphasis on working with our local partners. Perhaps more importantly, we were able to support our services financially during the pandemic, and that was through the payments that we made to our acute and mental health providers, and also supporting improved discharge arrangements, working particularly with the local authority and commissioning additional community beds. We also supported GP practices, particularly with premises adaptations that they needed to make during the pandemic. The historically accumulated deficit that we have reduced to 56.5 million by the end of the year, but this remains an issue for us as a CCG and our partners going forward to address. Next slide, please. In terms of where the money was spent, you can see a breakdown of that on this slide. Just around half of our allocation went on acute spend. And if you look at the table on the bottom right hand corner, there is a split there of how we spent the specific additional funding that came through the CCG for COVID-19. Most of that going towards the hospital discharge programme to support improved discharge, working with the local authority. Next slide, please. So if we bring it a bit more up to date, and where we are now, the interim financial arrangements remain in place. They continue to evolve. So we are working under arrangements for the first half of this year, which are quite similar to the ones we worked under for the second half of 2021. We are yet to have confirmation of our allocations and the interim arrangements for the second half of this year, the second half of 21-22. But what we will do is we'll continue to work with our partners in the local system to respond to the situation as it develops and ensure that we continue to support our services and deliver the financial targets that we have. As Siobhan mentioned, from 22-23, the CCG will effectively be replaced by an integrated care system. The transition will, of course, require careful financial management, and we are working and will continue to work with all our partners to ensure a safe and effective transition. I'm going to hand back now, I think, to Graham. Thank you.
Thanks, John, and thank you, Siobhan. Very concise and clear presentations there, and really illustrate the work of the CCG and the financial implications of what goes on as well. So thank you for that. I'm going to pause there just to double check if any of the governing body members wish to make any comment or ask any questions. Okay, thank you. The next part of the presentation is going to be about explaining and describing some of the work of the governing body and the subcommittees that enable it to perform its role. So if you could carry on, please, Andrea, and I'll have the next slide. So the governing body has a principal function to provide the CCG with an independent and objective view of the CCG's arrangements, exercise its functions effectively and efficiently and economically in accordance with the CCG's principles of good governance. We really do ensure that we're providing as safe, high quality, cost effective care as we possibly can. And the members of the governing body come from a wide range of expertise, which is described as a statutory requirement of different members. So we have senior CCG directors, we have lay members, we have clinicians, we have a chief a nurse representative, and we have a public health director from the local authority. And with this constitution, it allows us to perform the functions that we need to provide. We ensure that we challenge and provide scrutiny to the processes that are occurring, and we ensure that we are looking at our internal processes within the CCG. We have a high focus on risk management and the programme management within the CCG and the internal governance arrangements within that. But with all of that, we also look to be a supportive environment to make sure that we're as transparent as we can be and progressive as we can be in our outlook. And with that, we then take information from our committees that are subcommittees to the governing body, and I'll move on now to allow people who chair those committees to tell us a little bit about those committees. So Robin, can I ask you to come next, please?
Yes, thanks, Chair. My name is Robin Hudson, Medical Director of the CCG, and I chair the Clinical Management Board. Just to give you a bit of oversight as to what the board does, the board provides clinical oversight for finance, performance, quality and commissioning investments and its decisions. And we're there to ensure proper governance and sign off of all the organisational policies we have. And we ensure that any decisions we make are done properly and we manage our risk registers correctly. You'll see in the table on the slide that this table is put under all the minutes of each CMB, just to remind board members of the purpose of why they're there, in terms of the 5 aims, in terms of population health and well-being, patient experience, value for money and efficiency, definite and high priorities addressing health and care inequalities, and also not forgetting the workforce within Northumberland and thinking about their well-being and engaging with them meaningfully. And board members are often asked to think about the questions on the right-hand side of that table. Next slide, Andrea. Key themes for 2021, as you know, have already been reported. COVID-19. We've had to provide particular oversight especially on the impact on performance and quality caused by COVID, and also oversight of the vaccination programme from a clinical point of view. Performance has already been alluded to. A few issues just to pull out. One would be ambulance performance, and there have been concerns regarding ambulance performance, particularly because of demand. And the CCG has been engaging very constructively and rigorously with the North East Ambulance Service Trust to see how they can improve performance, manage their demand, and also find a sustainable footing in terms of quality. And other issues, one area just to highlight would be the ophthalmology services. There were significant challenges within ophthalmology due to COVID, largely due to social distancing, having a big impact on the volumes of individuals and patients who needed treatment for cataracts. And the CCG, with other CCGs, worked out a solution to try and increase the volumes being seen and going through as a throughput. So that's just one function of the CCG that you should be aware of. Next slide, please. Our key areas of work this year have been supporting primary care, and we, as a CCG, undertake sustainability visits. And we also, during the height of the pandemic, asked for situation reports, or SITREPs, which just gave us an indication of how practices were doing and kept the lines of communication open with practices. At the same time, as you will be aware, there was a rollout of a lot of new digital solutions and new ways of working, and we've had to support that financially, as well as keeping an oversight on patient experience. In terms of other pathways, FIT testing for colorectal cancer has been implemented over the last 12 to 15 months and has been highly successful at improving efficiency within the cancer services. And as has teledermatology, which has been worked across the whole of the North East to try and improve efficiency and allow our specialist colleagues to manage their workloads and demand much more effectively. And really of particular note, just to say, we made, in terms of mental health investment, we have a mental health investment expectation of spend of 5.35%, or £3.3 million of our budget on mental health. And at the end of last year, we agreed as a board to fund the development of a recovery college. And this recovery college is basically as part of our transformational agenda to support individuals not coming out of COVID, but also at a lower level in terms of individuals who do not qualify to be referred into specialist services, but who require support from the mental health and well-being point of view. As a CCG, we agreed to fund that, a recurring funding, £350,000 for this financial year, or for the last financial year. And as well as that, we also added in another £100,000 as part of Winter Pressures money. And this is the aim of rolling out a recovery college across our community to provide this lower level mental health support. And it will be wrapped around primary care and primary care networks. So that's very exciting. And we hope that by developing that, that will help us as we look forward and supporting our population further from a mental health point of view. Thanks, Graham.
Thank you, Robin. And next, we're going to move to Karen Bauer for a report from the Corporate Finance Committee.
Thanks, Graham. The Corporate Finance Committee assists the governing body in its duty to act effectively, efficiently and economically, and it assures the governing body that the CCG has sufficient capacity and capability to deliver its strategic objectives. It's been a very different year this last year for this committee, given the special financial arrangements that John's just outlined that were put in place in response to the pandemic. We increased the frequency of the meetings from meeting bi-monthly to meeting every month because of the unusual circumstances that we needed to have close scrutiny and because decisions were having to be taken quickly to ensure services were responsive to meet demand. We also needed to ensure that the decisions were being recorded because they were having to be taken quickly, and making sure that the right procedures were in place so that we were transparent and met national standards, which the committee was very assured that we did. It was a year in two financial parts. Overall, the year was one of two halves. For the first 6 months, the COVID costs were fully funded nationally through retrospective claiming by the CCGs. In the second half of the year, we saw allocations given at regional level across the integrated care system and planning across the region between trusts, CCGs and NHS England to ensure that we could manage within the allocated resource. The focus of the work for the committee again was somewhat different this year. The transactional monitoring that normally we would monitor over the year was much reduced as large proportions of the budget were paid directly to providers according to nationally prescribed block payment transfers. The committee focused on aspects of the budget that were variable, such as continuing healthcare payments and prescribing, and to help ensure that we managed our money within our allocation. We had very well developed plans for efficiency savings over the year, but again, due to the COVID issues, we weren't able to proceed with some of those well developed plans, which meant it resulted in only a small reduction to our overall deficit, as John has already outlined. Finally, the committee also monitors the human resources aspects, because that's another resource obviously for the CCG. The committee received quarterly reports on human resource issues, on staffing levels, on sickness levels, and we received a summary of the national survey that staff complete alongside the support that the CCG provided to our staff for home working and managing within the COVID pandemic. And overall, the committee was reassured that the staff felt very well supported over the year. So that's the work of the committee for this last year. Thank you.
Thank you very much, Karen. And now over to Steve Brazier for a report from the Audit Committee.
Thank you, Chair. Good morning, everybody. First thing I'd like to say is, obviously, as Chair of the Audit Committee, I'm very interested in finances. So I am a member of Karen's committee because a lot of what happened in the Audit Committee is related to what goes on in the Finance Committee. In blue on the slide, you can see the main purpose of the Audit Committee. And I think to summarise in a couple of words, when Graham did his slide, he talked about the governing body and good governance. And a lot of what the Audit Committee does is providing assurance to the governing body that we operate good governance within Northumberland's CCG. The principal activities of the Audit Committee are highlighted by the bullets, and to a degree, over the existence of the CCG, these have been fairly standard. But like everybody else, the pandemic meant we had to do things slightly differently. So I'm not going to read through those bullets, but just touch on a few areas where things were slightly different. So on the first bullet, John Connolly, our Chief Finance Officer, indicated that we operated under interim financial arrangements and we had additional funding sources. And one of the roles of the committee was to commission independent reports on how well we did against that and review those reports. So that was something that was slightly different in the year. One of our key activities every year is to review the annual report and accounts. And obviously, with the pandemic, the commentary in the report was very different. And we had some expenditure in the accounts from, John mentioned, the hospital discharge programme, which was very different to what we have in normal years. So that was slightly different. Risks, which is a number of contributors have referred to, those changed. So the committee had to ensure that the risk register was dynamic and kept up to date with the key challenges and priorities of the CCG. And finally, one of the things that the committee does on a quarterly basis is reviews at every one of the committee's meetings any conflicts of interest that are highlighted and satisfied itself that the right actions were taken as a result of those conflicts. So a challenging year overall for the Audit Committee, with some slightly different type of work to what we would normally do as routine. Thank you, Chair.
Audit Committee made simple, which is fantastic. Thank you. Next, we're going to come to Janet and the Primary Care Commissioning Committee. Janet Guy, please.
Thanks very much, Chair. Janet Guy, Chair of the Primary Care Commissioning Committee. You've got a slide there which sets out the main functions of the committee, but it is a bit general. It's rather terms of reference-y, really. So I thought probably the best thing for me to do this morning was to give you some real-time examples of the work of the committee this year to put a bit more life into the sorts of principles that the committee works to. And I think it's already been touched on by Siobhan and possibly by Graham as well, that one of the things the CCG tried to do this year with the overarching issues of COVID was still to continue with our regular work, business as usual, as far as we possibly could. And a lot of the terms of reference in our committee, as you'll see, deal with oversight and quality. And so throughout the year, we did continue with our usual monitoring of quality and service and trying to support improvements across the practices. And we do this because, of course, we have a large number of practices. We do this by using a wide range of indicators which are reported to us at each meeting. We also get intelligence from NHS England, from the CQC, and from patient and stakeholder feedback, so that what we try to do is spot potential issues in practices at a very early stage and take early action to prevent escalation and stop any problems occurring, so that we try and make sure things work smoothly throughout and we aren't suddenly confronted with a surprise issue. This year, we added to those processes something which Robin also mentioned in one of his slides, practice situation reporting, SITREP, which looks ahead to identify and understand pressures which are being faced by practices and support them through them. So again, we don't see big problems emerging which we could have spotted earlier, and we support that process by sustainability visits to the practices, again to talk about issues before they become significant problems. So that's our quality and oversight process. We also look at strategic development throughout the year and over practices, and this underlines a lot of considerations at all our meetings. One of the things we found was that when we make major changes to practices, and you'll see in our terms of reference that is one of our responsibilities is to approve these things, we find that these processes are very process driven, and practices tell us that they can seem complex and cumbersome. So we've been working this year on guidance to assist practices from the start of the process. So we started to look at standard operating procedures for practices applying for consent to certain structural practice changes to try and make that easier for practices to see them through this. And we developed a set of principles for primary care which would support commissioning and COVID recovery this year. One of the big strategic issues which faces us all the time is estates, and it's not just us, it's all areas. And there are some estate issues at most of our meetings. We have a range of estate across the county, and practice needs change, properties age, and of course constantly throw up the need for change. What we did notice this year particularly is that we know we have space pressure in some of our surgeries, and this became very apparent as measures were introduced this year for social distancing and enhanced infection control in practices, and some buildings actually became unusable as a result of that. So what we did at committee was we refreshed our estate strategy to take a comprehensive look at the issues we're likely to face, both in the short, the medium and the longer term, and prioritise them, and so plan how we can help practices to deal with their premises to be fit for purpose now and in the future. And in a moment, I'll mention some practical changes that we've seen this year. Linked to that estates review, we also made significant progress with 22 practices who are now progressing leases with NHS Property Services. And the significance of that is that it should release some financial investment into the CCG, which can then support practice and PCN growth and sustainability. So it should link into better use of our resources, both property resources and financial resources. So we're closely involved in that sort of medium and longer term estate planning. We're also responsible for approving practice changes. These only happen from time to time. We don't have them at every meeting normally, but they are significant because they have a direct effect on the public. And we're talking about things like practice closures, practice mergers, possibly the establishment of new practices. The first one that we were faced with throughout the first half of this year wasn't a good one to have to deal with, but it's an essential process for safety and it has to be handled well and sensitively, which is why I'm mentioning it, which was the closure of a practice in the Ashington area in July. This was as a result of safety and quality issues, which were identified during several inspections by the CQC, NHSE, and indeed the CCG. This is never a decision which is taken lightly, and it's a rare decision, but ultimately it was the only way forward to ensure safety and quality services for the patients. And of course, what made this particularly difficult this year was we were still in lockdown for much of this period. And so communicating with patients was key and difficult because everybody, of course, was at home. We also were very conscious that we had to ensure a very safe and swift transition of patients, particularly the vulnerable. We couldn't have people having to wander in and out of practices wondering where to go. So what we decided to do was we actually re-registered each patient with an alternative neighbouring practice, although of course we told them they had the right to move to different practices if they wished. And it actually worked extremely well. It was a very difficult time for patients and it was exceptionally hard work for staff, particularly those in the receiving practices. But the lesson that came out of it was the enormous amount of staff time and planning and resource that went into this meant that when we do have to do something as unfortunate as a closure, we did complete it as smoothly as possible and we did get generally positive feedback from patients. So a rare event, but it did go as smoothly as such things can. On a more positive note, which is much more common, in July, we approved the relocation of a premises in Wylam to another of its health centres in Prudhoe because the Wylam premises were no longer fit for purpose. And the result has been that there are improved facilities, there are improved services, and the new premises can accommodate new patients from surrounding housing developments, because this is another big issue for general practice where there's a lot of housing development, a lot of people, a lot more patients, space and services required. We also approved, subject to various necessary steps still ongoing, Felton's practice proposals to relocate to a new build in the village, which is really good news because the current premises have very limited accessibility, can accommodate limited services and actually can't be made COVID secure. So we hope by the end of 22, early 23, there'll be a new build surgery in Felton, which is really good news. And we also approved the closure of a small branch surgery in Camis because the surgery was unfit for purpose and actually was becoming unsafe. At one point there was, I think, a fear that the ceiling was about to or did fall in. So things like that are very important, have to be dealt with. And as a result of that move, there's also been a new extension at the main site agreed with NH Property Services funding agreed for that. So again, an improvement of facilities for patients and of course safety for everybody. So you probably see through that the focus of the committee's work with these changes in practices is always twofold. It's the improvement of services to patients, and it's ensuring the sustainability of general practice in Northumberland, and this is what we're always looking at. Final point, I was going to mention COVID. You've heard enough about that already. The only thing I will say is that we've supported general practice to deliver among or the best vaccination numbers in the whole of the country. And I must give you a little quote from one of our staff talking about the roving vaccination unit, which I thought was wonderful. She said, "You won't believe 2 women in a van in a car park vaccinated 1,000 people. You can't beat that." And I thought that was a really good summary of the imagination and the achievement that general practice has made this year. So well done, everybody. Thank you, Graham.
Thank you very much, Janet. So lots of information in the last 5 points. I'm going to pause again to see if anybody wishes to make any comment or ask any questions from the governing body. Okay, so as I said at the start, this recording will be on our website, and we would welcome any questions that anybody would wish to submit after the meeting. Follow the links on the website. We will accrue the questions, and then we'll work out how to answer them in a public way, and we'll work with our officers to make sure that happens. I'm going to summarise now before I bring the meeting to a close, and just in terms of what I have heard this morning. I've heard about the challenge of COVID, and we mustn't underestimate that and the effect that it has had on everybody. The work that has gone on in the health system, in primary care, in our hospitals, but also the work of the officers of the CCG and the impact that it has had on all of our working lives. We must also celebrate the vaccination rates in Northumberland. We are one of the highest vaccinators in the country, and that is in no way a lot of credit is due to our primary care colleagues and everybody else who's contributed to that effort. So we must remember that. Putting COVID aside, I've also heard how proactive we wish to be in putting time aside to thinking about how we care for the people of Northumberland in the future. And I've heard about health inequalities, and in my mind, that's really about making sure all of our population have a fair and equal chance of a healthy life. And that really is at the core of what we're trying to do here. I've heard about children, and none of us can deny how important the best start of life is for our children to enable us to do that. We've heard about mental health and the impact that that has and how important our services are for that. And then we've heard about working together, and I think the work of the CCG is very much about working together, not just with the partner organisations that provide healthcare, but also, most importantly, our communities. And that really does need to be a real focus for us going forwards, and especially as we move into our new structure as an ICS. Finally, I need to say thank you. I need to say thank you to the members of the governing body for their diligence and support to ensure that we are performing the functions as well as we possibly can. And then I need to say thank you to all of our partners in the organisations around Northumberland for all of the work that they have also contributed, and to continue to be proactive in the way that they are. With that, I will draw our meeting to a close. So thank you very much to everybody that's contributed this morning. I think it's given a really clear and concise flavour of what Northumberland CCG is all about. And I look forward to working with you again in the future. Thank you.